I'm starting the broadcast.
The broadcast is now starting. All attendees are in listen-only mode.
Good evening. Thank you all for joining WomenHeart, the National Coalition for Women with Heart Disease, for our second annual National Women's Health Week Patient Education webinar, Empowering Women to Take Charge of Their Heart Health. I'm Eva Masiejewski, Consultant for Communications and Marketing at WomenHeart. I will moderate this session tonight. Before I turn it over to Lisa Tate, our CEO, let me reiterate that this is a one-hour webinar, and let me explain a couple of features very quickly that are on your control panel. Currently, all participants' lines are muted. I will unmute your lines at the conclusion of the webinar for the Q&A portion of this webinar. There will be 15 minutes for Q&A at the end. At that point, to ask a question, you should type the question by clicking on the question mark icon on your control panel. Your question will come to me and will not be seen by the other participants or the speakers. I will read it out loud, and I'll read them in the order in which I receive them, and then I will let the speakers answer them. Alternately, you can also ask a question by clicking on the hand icon on your control panel. However, I encourage you to click on the question mark icon and type in your question. Now let me turn it over to WomenHeart's Chief Executive Officer, Lisa Tate, for some opening remarks.
Hello, everyone. I'm Lisa Tate, and we're so pleased you're joining us today. You know, tonight's agenda is full. We have lots of information jam-packed in it and fabulous speakers. And what we hope you're going to do tonight or today, depending on where you are in the country, is take this information, use it yourselves, but just as importantly, take it home and pass it along to your mothers, your sisters, and your friends so that they can also take charge of their heart health. Our distinguished presenters today are Dr. Annabelle Volgman, Director of the Heart Center for Women at Rush University Medical Center in Chicago, and a member of the WomenHeart Scientific Advisory Council. Welcome, Dr. Volgman. We also have a special treat tonight, internationally renowned Chef Lala, who will share important information about the role of nutrition in heart health. We're also pleased to say that tonight we're partnering once again with Burlington Coat Factory to bring you this special presentation. As a company committed to the heart health of its customers and all women, Burlington continues to support WomenHeart's efforts to bring vital heart health information into the heart of communities nationwide through their stores and through activities like this webinar tonight. Without further ado, I'm going to turn the program over to Dr. Annabelle Volgman to shed light on how we can prevent and manage heart disease in women. Dr. Volgman.
Thank you so much, Lisa. It's my pleasure to be here today. Thank you, everyone, for joining us and learning about women and heart disease. I am the medical director at the Rush Heart Center for Women, which has been treating women to prevent and to treat heart disease for the last 10 years. So we have a lot of experience with a lot of women with heart disease and or at risk. And I want to just share with you what we know at this point. Some of the people know, but we should all know that heart disease is the leading cause of deaths among American women. And for more than 42 million women are currently living with or at risk for some form of heart disease. And unfortunately, more than 8 million women are currently living with heart disease, and another 34 million are at risk. So we need to get to those women who are at risk so that they don't become the women who are living with heart disease. What some people don't know is that heart disease actually is the leading cause of deaths in American women, and that it is more than all the cancers combined. So a lot of women are scared of cancer, but they really should be more scared of heart disease because it kills more of us than all of the cancers altogether. Women are less likely to receive treatment according to cardiovascular disease prevention guidelines, and so we really need to educate not only women but doctors. In the next slide, we'll see that a woman dies every minute from heart disease, and that more women than men die from heart disease since 1984. And some people still think that heart disease is a man's disease. And as you can see from the slide, there are more women dying of heart disease than men since 1984. And 1 in 3 women will die from heart disease. The next slide it just talks about African-American women, and we'll talk about African-American women and Latina women because they are the least aware and they are at the highest risk of heart disease. So African-American women have a higher risk of heart disease than Caucasians, but they're less aware of the risk factors. And it's really very disheartening to see that 51% of women are obese. And in addition, 26% are overweight, and that's a lot of numbers. Physical inactivity is very common in African American women. 64% of these women get no physical activity, and high blood pressure is rampant in African American women and men. Diabetes is also a big risk factor among African American women, and their diet have very high sodium. 45% of African American women over the age of 20 have high blood pressure, and unfortunately these young women actually are on birth control pills, and obesity, high blood pressure, and birth control pills really put them at a very high risk of strokes, and that's the population that we're seeing a big rise in stroke is the young women who are obese. So we really need to educate those women. African American women bear a disproportionate burden of stroke, heart failure, and kidney disease, all due to undiagnosed or poorly controlled high blood pressure. In the Hispanics and heart disease, 70% of Hispanic American women have at least one risk factors for heart disease, and only 38% of them recognize that heart disease is their leading cause of death. So we really need to educate the Hispanic women better than they already are. They also have a slightly higher risk for heart disease than Caucasians, but they're less aware of their risk factors. Among the Mexican American women, 31% are overweight and 45% are obese. And they also have a high rate of physical inactivity. And among the, oops, go back please. Among the Mexican American women over the age of 20, 29% of them have high blood pressure. Among the Hispanic American women, diabetes is also very high rate, 12%, but that's twice the risk of Caucasian women. So we really need, there's something about the Hispanic women that have a higher risk of diabetes. So we really need to educate them. Among Mexican American women, 31% have cardiovascular disease. In terms of diabetes, and as you saw, diabetic women, diabetes is rampant in African American and Latino women. 10 million women have diabetes, and 8% of them are in women that are 20 years and older. 2.7 million women are undiagnosed, so we have a lot of women who are walking around not knowing that they have undiagnosed diabetes. And unfortunately, there are so many, many more that have pre-diabetes, and the time to act for those women is when they don't have diabetes yet, because they can really do a lot of lifestyle changes, change their diet, decrease their weight, and start exercising, which can really prevent diabetes. A lot of women don't realize that diabetes is preventable, and we really want to emphasize, and Chef Lala will go over the kinds of foods that they need to avoid to get diabetes. And there is a huge link between diabetes and heart disease, if you don't already know. Women with diabetes are 2.5 times more likely to have a heart attack. And heart disease is the leading cause of death among people with diabetes. About 2 out of 3 people with diabetes will die of heart disease or stroke. Adults with diabetes have heart disease death rates about 2 to 4 times higher than adults without diabetes. So once you get diabetes, doctors start putting you on a lot of medications because of this problem with heart attacks and strokes. And so my plea is to not get the diabetes, and it is so preventable for most people. So I think we really need to emphasize that. Next slide. In terms of obesity, it is the leading cause of diabetes, and that's why we really need to emphasize keeping your weight down so that you don't get diabetes, and you don't get high blood pressure, and you don't get heart disease. There are 71 million overweight and obese adult women. That's 62% of women in the United States. That's staggering. We really need to do something about that. 32% of Caucasian women are obese, 26% are overweight, and it just gets worse for the African American and the Mexican American, as you can see. The risk for cardiovascular disease increases by 20% in women who are overweight and a staggering 64% in women who are obese. So when I talk to my patients in my office, when they reach that body mass index of greater than 30, I really emphasize how high the risk becomes, and to try to lose weight and get their risk down. Even if you just get overweight, that risk is much, much lower than the women who are obese. So try to get your weight down to your ideal weight, or at least don't get overweight or obese. 46% of adult women have a total cholesterol of at least 200, and we consider a total cholesterol of greater than 200 a risk factor. The increasing prevalence of obesity is driving an increased incidence of type 2 diabetes. So concentrate on your weight, and we'll give you some tips on how to avoid diabetes in this talk. Depression. Depression is something that we have really tried to emphasize recently, because we are seeing that depression can increase the risk of heart disease, and depression is twice as common in women as it is in men. And as you can see in the slide, it increases the risk of heart disease by 2 to 3 times. The Women's Health Initiative study found that the women who did not exercise regularly, had high blood pressure or diabetes, and who reported fair or poor health were more likely to be depressed. So that exercise can really help decrease depression. That's also been found. Depression, unfortunately, is difficult to diagnose in women with heart disease and other medical illnesses, sometimes because atypical depression symptoms are similar to heart disease, so it's really hard to distinguish those two. Women are also less likely to be referred to cardiac rehabilitation, and therefore they don't have access to the social support and assistance, which is so important in decreasing depression in women. So what should we know? We should know the ABCs of heart disease. First thing to figure out is whether you should be on baby aspirin or aspirin therapy. And it's not right for everybody, but in general, women, even with low risk for heart disease, if you're over the age of 65, we recommend a baby aspirin for you to decrease your risk of heart attacks and strokes. But for women under the age of 65, you should really consult your doctor if you need aspirin. For the most part, if you have risk factors for heart disease, you should be on a baby aspirin. B is for blood pressure or high blood pressure. Know your numbers, get to your goal with that. Also with cholesterol, know your numbers, know what your bad cholesterol numbers are, triglycerides and HDL numbers, and get to your goal. And then the S, the ABCs, the S is smoking. Absolutely do not smoke. If you smoke, you are really putting yourself at risk for heart disease and strokes. And it doesn't matter whether you're young, you could be at risk for stroke if you smoke. So please do not smoke. Also, diabetes is a risk factor, as we already talked about. Sedentary lifestyle, so try to exercise about 30 minutes a day, every day, and to control your weight. Next slide shows that we really need to emphasize blood pressure control, and it's so easy to figure that out. You don't even have to go to the doctor to know your blood pressure. Just go to your local drugstore like Walgreens or CVS, and they have blood pressure machines in those, and just get to know what you should aim for. Everyone should have a blood pressure less than 120/80. If your blood pressure is normal, you can work with your healthcare team to keep it that way. But if your blood pressure is over 120/80, please go to your doctor because they need to monitor that. And it doesn't mean that you're going to be put on blood pressure medications. We usually don't put patients on blood pressure medications unless it's blood pressure of 140/90. But you don't want to get there. You want to get your blood pressure controlled, and preferably less than 120/80 for everybody. And there's a website that you can go to get more information about that. So what should you know? There are other risks that you can't control. Age. But fortunately, if you exercise and do all the right things and eat the right foods, you can actually decrease your risk even if you get older. So age is not necessarily a bad risk factor. I know a lot of 90-year-olds who don't have heart disease because they're doing the right thing. Family history. Know your family history. Ask your parents what your grandparents died of. And if anyone dies early of heart disease or stroke, or if they've had a heart attack in their early 40s or 50s, you need to know that, because then you can get your blood tested and you can be followed closely. Unfortunately, race and ethnicity also have specific risks, as we talked about in the African American and the Hispanic. For the Southeast Asian people out there, it is their #1 risk is heart disease, and a lot of people don't know that. The Southeast Asians have high Lp(a) and low HDL, and if you're one of those people, you are at very high risk for heart disease, much more than African Americans and Hispanics. It's just that we don't talk about it in America because they're just a minority, but I think that we really need to emphasize that the Southeast Asians need to have those things looked at. Next slide. So I'm sure that you've all seen that women don't have the same symptoms, but for the most part, women will still complain of chest discomfort or sensation in their chest when they're having a heart attack. Don't think that it's just indigestion or something that you ate that's causing that chest discomfort, especially if you have risk factors. But even women who don't have risk factors, if you have the sudden change in the way you feel in your chest, that might be a heart attack. Call 911. Don't drive yourself to the emergency room. Especially if this chest pain or this chest sensation goes to your arm or your back or your neck or your jaw. Those are very common symptoms of heart attacks in women, especially if you're having any shortness of breath. With or without the chest discomfort, that's a bad sign, especially a sudden change in your breathing. If you're suddenly short of breath, that's not a good sign. I'm going to go a little bit faster because I know I only have 15 minutes, so I'm going to try to go a little faster. Go to the next slide, please, Eva. I want to emphasize how important stress is, because we're seeing a lot of women who are under tremendous stress in their workplace, and they don't realize that this constant stress can be a big risk factor for heart disease. Many studies have shown there is a strong link between chronic job stress and heart disease, such as high blood pressure and heart attacks, frankly. And this prolonged work stress can cause physical inactivity, unhealthy eating, smoking, and other cardiovascular risk factors. Women with high stressful jobs have a 40% increased risk of heart disease. Some of the things that we recommend for women to decrease the risk of heart disease from stress is taking a few long, deep breaths every few minutes. Take a break. Increase your, if you are at your desktop, if you have a desk job, walk around, take a break, take a walk, because this really can decrease your stress level. Take a heart-healthy lunch to work instead of buying food at work. Create your own heart-healthy lunch at home. And there are also other strategies that you can do, such as inviting your coworkers to become heart-healthy and take walks with them. Next slide. So just to reiterate, these are habits that you should do to lower your risk of heart disease. Commit to a heart-healthy diet, which Chef Lala will talk to us about. Exercise daily, at least 30 minutes a day. Watch your weight. Quit smoking. Know your numbers, and get to your blood pressure goal, your blood sugar goal, cholesterol, and triglycerides. Know your numbers and talk to your doctor to determine if they are healthy. And again, manage that stress level. I'm not going to go through all of this. I think that you can, this is just to reiterate what we should be doing. Just to emphasize the birth control pills. If you are taking birth control pills, that can increase your triglycerides and increase your blood pressure. So make sure that you are being watched carefully for those things. And just to reiterate, if you think you're having a heart attack, call 911. Most women will not call 911, but please, if you are having symptoms of a heart attack, don't delay, because every second counts when it comes to the heart and the brain. Don't drive yourself. Don't let your family drive you, because they don't have the right equipment to treat you. That can be done while they're in the ambulance. That could save your life. Also, if you think you're having a heart attack, chew and swallow 1 full regular strength aspirin with the water. Do this as soon as possible, because it can decrease the amount of heart muscle damage. And then when you're in the hospital, make sure that they know that you are at risk for heart attack and that they should be evaluating you immediately, because women are sometimes ignored more than men. So be aggressive and be assertive to those emergency room doctors. My last slide is what you should do. Again, lower your risk with the right information, support and answers. Develop an action plan with your healthcare provider to lower your personal risk of heart disease. And then be a partner in your healthcare decisions. You don't always have to be on medications to lower your risk. Talk to your doctor. Make sure that you understand what your condition is, what you should do on your own, and what the expected results are. Thank you for your attention.
Thank you, Dr. Volgman. That was fabulous. Every time I hear this presentation or similar presentation, even I learn something, and I know all of our participants did tonight. So thank you so much for taking the time. Really appreciate it. This is Lisa Tate again, and I am going to now have the great pleasure of introducing our next speaker and presenter, Chef Lala. Chef Lala is a nationally recognized chef and recognized for being at the forefront of the healthy revolution of Latin home cooking specifically. Her cooking and her expertise has been formed by her experiences growing up in the Mexican culinary traditions she learned in East Los Angeles, as well as summers she spent with her grandparents, both in Mexico and Baja California, and also her current visits to local sights and sounds of corner markets and local bakeries where she lives in the LA area. Coming from a family with a history of diabetes, she realized early in her career the importance of helping people make healthy food choices. And in addition to the training she received at the Cordon Bleu in both Paris and Los Angeles, Chef Lala became a certified nutritionist and remains focused on preparing delicious recipes that are also health conscious. She now serves as a spokesperson for the American Diabetes Association and was recently honored by the Joslin Institute for her work educating the Latino community. Chef Lala has frequently appeared as a guest chef on national television shows such as The Today Show, The Dr. Oz Show, and The Martha Stewart Show, and has amassed, lucky for you all and our participants tonight, a substantial online following through her regular recipe and healthy eating posts on multiple social media feeds, including her website, cheflala.com. So we are really pleased to be able to have her with us tonight. As you can see, she's very busy, as well as is Dr. Volgman. So let me turn it over now to Chef Lala.
Hi, thank you. Thank you for having me, first of all, and I want to congratulate everybody who took the time to make time for themselves today and be part of this and just empower themselves and look for ways to be better. As a mom and a business owner, I get it. It's really, really difficult to make time for yourself, and a lot of times that's what leads to disease. And so what I'm going to go through today is not anything you haven't already heard for the most part from most of you. I'm just kind of reminding you again of why we make the decisions that we do and why as professionals we keep repeating this information over and over. I've been doing this for over 20 years, and no matter what you look at and how you look at any diet, and I don't call it a diet, for me it's really a lifestyle. It boils down to this: calories in, calories out. You know, and if you don't expand the calories that you consume, you end up storing them, and then that leads to obesity, and which, like Dr. Volgman said, obesity is the leading cause of diabetes and heart disease. So that's where we want to try to nip it and try to help you guys make better decisions. So when we review this, we want to keep in mind why fat has a terrible, terrible reputation as well as calories, because 1 gram of carbohydrate equals 4 calories as well as protein. And fat, it's very, very easy to add it all up because it has 9 calories per gram. So it's really easy to pack on the extra calories, as well as when you drink a little bit of alcohol. I did a nutritional analysis one time on something, and a margarita had 900 calories, just one margarita. That's astounding considering that at 5'0", I consume an average of about 1,500 calories. So just make sure that you pay attention to the amount that you're consuming in each one of these nutrients, because they will add up. So on the next slide, okay, so what's a protein? You know, proteins are what help you build the muscle. And remember something, your body takes a lot of energy to be able to process this protein as well. So by eating, say, for example, a breast of chicken, your body's using up some carbohydrates in order to be able to burn it. But once again, you know, we come to why Latinos, like we were talking about, the African-American community, why it is that we're suffering at such an alarming rate. You know, when we used to, I remember eating at my grandmother's house, we never got like a side of cow or a side of pig, you know. We got this like little piece of meat that, and it happened to be like, it was almost like a little decoration to all our fruits and vegetables and our legumes. I want everybody at home right now to make a fist. Okay, that's the size of your stomach. So if you're eating a 12-ounce steak, you have to think, where is it going? If this is the size of my stomach, so you should be eating 5 times that size of your fist a day. That's what you should be consuming. Okay, so going on to the next slide, we have the proteins, which you guys saw. There's chicken, beans, turkey, milk, fish, yogurt, meats, nuts, eggs, cheeses, tofu. There's all kinds of great ways to consume proteins. But if you are a vegetarian or a vegan, keep in mind the 2 half proteins, meaning a bean and a tofu, do not make a whole protein. So especially when somebody is, for example, pregnant, they should definitely talk to their primary care physician or their gynecologist about the dietary restrictions and whether or not you're meeting them. So going on to the next one, we're on carbs. Now, carbohydrates have a bad rap, right? Let's go back up, Eva, if you can. The carbohydrates get a bad rap because you either heard about the no-carb diets and how people lose weight. Carbs are basically energy for you, and it's not really a bad thing. What happens is that we end up eating a lot of empty carbs. For example, you know, you get a bucket of these little jelly beans that are so fantastic. You start popping them in your mouth. Before you know it, you eat a whole lot of carbohydrates, of processed carbohydrates. And specifically for someone with diabetes, the reason that sugar has a bad, terrible rap, other than the fact that it processes quickly and raises your sugar, is the fact that there's no nutrients whatsoever. So, you know, when I was expecting my son, I remember eating and thinking, okay, what is this going to do for me? And everything that I put in my body at that point was like, if I wasn't nourishing Maddox, I just wasn't having it. So, and it's funny because right after I finished breastfeeding and everything, I went back to my old ways of just kind of eating to eat. And I realized, wait a minute. As a mom, I was so concerned about being healthy and putting healthy nutrients in my body, specifically carbohydrates. But now that it's only up to me, you know, I have to be able to secure my mass in order to secure the mass of others, which is my son. So if I have a heart attack, or if I have diabetes, or any of the comorbidities associated with obesity, then I put myself at risk for not being there for my son as much as I do as feeding myself bad food when I was pregnant. So when you're talking about carbohydrates, try to eat stuff that's high in fiber, that's going to make you feel full longer. It also has fats, like they say, push everything around, and helps you with digestion, and you'll feel the difference in your skin, in your hair, in your breath. It's wonderful when you start eating carbohydrates that actually have a lot of nutrients, like pears and berries and cauliflowers. And even when you do choose some sort of carbohydrate, if you do a tortilla, wheat, pasta, make sure that it's wheat or a whole grain, because that fiber is going to help offset the absorption of the sugar or the rate at which it's absorbed in. So let's go back down to fat. Now, anybody who says fat doesn't have flavor, just never had bacon. I mean, I grew up with bacon in my family, carnitas, and the whole 9 yards. Fat is good, and you know, as a chef, I'll tell you, that's the key to making food taste good. You add butter and bacon to anything, let me just tell you, it's fantastic. And so if you remove all of that wonderfulness that's going to crisp up the food or make it extra flavorful, you have to find different ways to add it back in so you don't feel like you're missing out. And you could just look so far as to your culture. So, for example, me as a Mexican, I'll do chili peppers. You know, I have a friend who is Italian, and he'll do a tomato sauce. My other friend, you know, she's Persian, and she does saffron and all these wonderful herbs and spices. So look to your culture, and you'll find that traditionally we flavored food naturally. We weren't so big, especially in the Americas, where we didn't even have cows and pigs before the Iberian influence. We would do stuff where we would bake, boil, steam, charbroil, stir fry, things that were healthy cooking methods, but infusing a lot of flavor and not drowning the food necessarily in tons of fat. And if you do add something, I mean, hey, I'm all for it. You know, just sprinkle it on, just a little bit over it, you know, and choose something that is not saturated. What's saturated, what's not saturated? Really easy way to find out. If it's solid in room temperature, that means it's a saturated fat. That's what you want to stay away from. That's what's going to clog up your arteries and make you sick. So kind of stick to the stuff that's liquid at room temperature, and you're talking about a better idea. Olive oil is a really good idea for not for cooking, because it has a lot of wonderful nutrients in it, as well as, for example, grapeseed oil. You could cook at higher heat. A lot of nutrients also. If you want a very simple, plain, non-flavored oil, canola oil is wonderful. And then nowadays, I mean, they have oils that are flavored like with chipotle or, you know, garlic. Try some of those. Those are a fun way to cook also. The way I know good fat, bad fat, LDL is a lousy cholesterol. HDL is a healthy cholesterol. So that's how you know. It's an easy way to tell whether you're doing a good thing or a bad thing for yourself. Okay, moving on to the next slide. Okay, tips for fat in your nutrition. You want to consume less fried food, obviously. If you're frying it and battering it, you're, once again, pumping up your calorie intake like crazy. You want to use low-fat cooking methods, such as steaming and boiling. You want to choose foods with lots of flavors and less fat, like we talked about. But be very careful when you go to the supermarket and you see stuff that's less fat. Remember, they're removing the fat. They're going to want to add something for flavor, and a lot of times they add sugar. So make sure that you're not going from something bad to worse. You want to take something that comes in its own package. That's a good idea, like an apple, you know, an orange. Those are things that comes in our package. Shop on the outside perimeter of the supermarket, and you're going to have, you're probably going to be making a better choice. You want to limit the fat in your meals. Now, I keep talking about fat, but remember, fat is essential to life. Certain vitamins get processed in it. It's just about the good fats. And you want to choose low-fat reduced fat dairy products, because that's a great way to cut it down without all the flavor. I've actually gotten used to myself lower fat milk over whole milk. So that's just a really good way to start shaving little calories here and there. And you want to read the nutrition labels to determine the type of fat in your food and how much fat per serving. And if you're at a restaurant or something, there's no harm in asking. Now, most places have it by law. Most states have it by law that you have to be able to list what kind of fat that you're getting. Okay, so the next rule is you want to balance proteins and carbs and fat. Remember, especially those who have diabetes, the way you process your foods when you consume it is, first of all, it's the simple sugars, and then the carbohydrate, then a protein, then a fat. That's why if you've ever had like a coffee and a donut in the morning, you know, you go up because the sugar is going to get you that high, and then boom, you're going to crash. Ideally, what you want to do is maintain that energy level throughout the day. So if you eat a well-balanced meal, you're going to burn your simple carbohydrates, your protein, your fat, and guess what? It's time to eat again. So you maintain that nice, wonderful energy throughout the day, as well as your sugar levels, and you're also being able to manage your blood glucose. Realistically, you know, everybody should be eating a diabetic diet. Three of my four grandparents died of complications of diabetes. Two of my parents have it. 7 out of 8 of my uncles have it. Now my little sister has it. Now I don't have it, but I know that by eating a diet and being conscious of what I consume and what it does for my body, I'm actually making great choices. I met a triathlete one time that said, they asked him, how could you be a diabetic triathlete? That's like an oxymoron. And he said, no. I know what an apple does for my body. I know how many miles I could run on something, on anything. And whereas somebody else doesn't, I have a gauge. So we all have that gauge. So when you consume stuff, think about it. What is it doing for me? You want to use fuel for activity and provide essential nutrients to be healthy. Going on to the next one. Okay, what women need to know to make healthy nutrition choices. You need to read the nutrition labels. You would be surprised. And I love when people try to ignore, oh, it's only 80 calories. Yeah, honey, but it's 6 servings. Just be real with yourself. Really be real with yourself and be conscious of how much you eat. Portion size is so important. You need to write down what you eat. I know it takes a lot of time, but you know what? If you don't have time to do stuff for yourself now, you don't have time to work out or eat right or make better choices, make a lot of time for disease, because Dr. Volgman can tell you it takes a lot of time and a lot of money to be in the hospital. So you need to, being preventative actually is going to be a lot better than afterwards saying, oh man, I should have done this. So just take the time to write things down and you'd be surprised how quickly that all adds up. Next slide. Okay, and then here's some quick measurements. I don't have time to measure, Lala. Check it out. Like I said, a closed fist, that's the size of your stomach. 2 fingers is an ounce. So when they say, oh, eat 2 ounces of cheese, now you know, okay, this is my finger size. An open palm, that's a single serving of meat. That's how much, not your whole hand, guys, just your palm. That's the serving of meat you should be eating at. And the tip of your thumb, that's what a teaspoon of butter should be. So when they say, okay, add a teaspoon of butter, you know, it doesn't mean slice off a chunk of it. Like one of my sisters do, just, you know, a little bit goes a long way. And before you keep adding and adding, you know, it's better to add a little bit more than you have to take it away. So usually when I like to add something indulgent, I add it slowly. I incorporate it slowly because it's already in there. It's like, oh, well, I already added the butter. It's delicious and I'm going to eat it. So just, you know, do a little bit at a time and then you find out that, well, you know, actually a teaspoon was enough. Next slide. Okay, we're talking, you know, Dr. Volgman touched heavily on depression and eating, and you know, eating and what you eat goes hand in hand with depression and how you're feeling. And I'll tell you, and I'll admit it firsthand, you know, there's days where I could just go for that quadruple, double, triple cheeseburger with extra chili and all that stuff. But realistically, it's just going to kill me and send me over for the top for like 3 or 4 days. So I'm just going to do my body more harm than good. So, you know, think about it. Think about why you're doing something for yourself. And, you know, the way I've taught myself really to make better choices, like I said, first of all, I put my family first and I think about my son. You know, as a single mom, I really do have to be careful about the choices I make because my responsibility is, you know, tenfold now. But I think about it and I say, okay, look, I'm that upset. If something didn't go right for me, you know what? I'm going to do something right for myself. I'm going to put avocado in my sandwich today. And who doesn't like avocado? It's so yummy, instead of my mayonnaise. And then I get this big stack of like turkey, roasted turkey, and I toast my bread so it could be extra crunchy. So where I'm actually being healthy, I'm actually being good to myself, but I'm not doing it in a counterproductive way. So I try to tend to spoil myself with yummy, delicious things like, cucumbers with salt, chili, and lime, but things that are actually good for me. And so I'm being good to myself. If somebody else isn't being good to me, and that's not going to send me over the top and send me down on a down spiral to think I'm also not going to be good to me. No, it's going to be the opposite. You weren't good to me, so you know what? You reminded me that I need to be good to myself today. So I'm going to make myself a fresh lemonade. Next slide. Enjoy what you eat. Oh my God, I love it when people take out all their favorite dishes that they love for their mother-in-law and they don't even like her, right? So I take out my dishes all the time. I take out my nice dishes all the time, and I celebrate everything I eat. And when we sit down, my son sets the table, or the entire family comes. The best moments are around the kitchen table. The worst thing you could do is sit in front of the refrigerator and poke at stuff, or while you're cooking, poke at stuff. Hey, I get it. I do it all the time. It's fun. It tastes better from the pan, just like French fries taste better on the way home. But I try to refrain, because when you sit down and enjoy the meal, not only are you taking the time to enjoy your food, but you're also getting good conversation, great family time, but you're also being able to realize how much you're eating. And remember, when you eat, it takes 20 minutes for your body to realize, oh, I've eaten. So, and then you'll tend to continue to eat because you're not full yet. But wait 20 minutes. Even when you go to a restaurant and you want to have dessert, wait 20 minutes. Chances are you want to just want to share one with a whole bunch of people instead of just one by yourself, because it takes that long for your body to know, oh, okay, she just fed me. Are we done? Okay, and then we say, was this my last slide?
Yes, that is.
Okay,
Thank you
so
so
one
much.
last thought. Pay attention to the colors, flavors, aroma of each food on your plate. I say food is like dating. It better look good, smell good, taste look good. And, you just have to make it. It's such a pleasurable thing. Unfortunately, with all the, like I said, disparities and comorbidities associated with obesity, sometimes food gets a terrible rap. About being just this evil thing, and it's not. It's a beautiful thing. And with all these different resources we have out now, with Food Network and Bravo and all these cooking shows and online and cookbooks, and you can go and find solutions to how to do things healthy. So somebody said, well, my mom always fried my chicken. Well, okay, where's your mom? Well, she died of a heart attack. Okay, well, if your mama knew different, would she have done different? She probably would have. So why don't you try Googling baked chicken, baked fried chicken? And she did, and she tried it, and she was like, wow, fantastic. So, use your resources to make your life delicious. It's not about weight. It's not about being or looking a certain way or being vain. It's about a better quality of life. And by being able to make better choices and nourishing your body with all this delicious food, you too can live a better quality of life.
I absolutely agree. This is Lisa Tate again, and that was fabulous, Chef Lala. Yet again, I learned a lot myself. Of course, it also made me a little bit hungry, so here on the East Coast. We are going to, I'm just going to quickly tell, again, our participants how to ask questions. We will, just as a reminder, type the question by dialing, by clicking on the first question mark or the question mark icon on your control panel. Or you can alternately click on the hand icon on your control panel, and we'll mute your line and let you ask your question verbally. But email works the best, or the online question mark icon works the best, and we can keep it the best organized. So while you all are queuing up for questions, just a couple of things. What do we do now? We've learned a lot from Dr. Volgman. We've learned a lot from Chef Lala. What we want people to do is both internalize this information, but again, talk to your mothers, your sisters, your friends about this information. As a reminder, one of the ways you can do that, or a way to help you do that, is get more information. This presentation will be posted on our website, WomenHeart.org, where there's a lot of other free heart health information in a whole variety of formats and in Spanish. Partner with Women Heart by helping us set up a support group for women with heart disease in your community. And you can do that, again, by going on WomenHeart.org and looking for information about our National Hospital Alliance, where hospitals locally partner with us to to provide support for women living with heart disease. Learn more, and certainly consider making a donation to support our organization, because it's only with your donations that we're able to provide programs like these, as well as all the other services that we provide around the country. But we want to now go to questions without further ado, and I'm going to turn that over to Eva, because she's a lot better at kind of moderating the questions and the technical part than I am. So if you just hold on a second here, you'll find it. While she goes to that, I want to again thank our primary sponsor for tonight's webinar, and that is Burlington Coat Factory. We hope that everyone knows that they both support us very generously by doing a point-of-sale program every February in their stores, where their generous customers donate to our organization. And this year, they raised for us over $1 million. And all of that money goes back into local communities where WomenHeart has volunteers and other types of support activities. And we're so thrilled that we partnered with them this year, and that we also partnered with them and continue to do that this month during Women's Health Week, where we also did a lot of educational programs at their stores around the country. So Eva, can I turn it to you to do the questions now? Thanks.
Okay, this is Eva. Sorry, I am just putting it here. So we have a question here. I believe this is for Chef Lala from Shirley Sanders. Which is best, margarine or butter? Margarine or butter, if both are liquid?
Well, butter's not, it's liquid because they put something in it, but margarine is actually man-made, and it's usually a hydrogenated fat. That's what makes it solid. I don't really know what would make, I would think that they would have to stabilize it, and in that case add some sort of chemical to make it liquid, which is kind of icky to me. I think I would just prefer a smaller amount of regular butter so that it tastes delicious and there's no icky chemical in it.
Can I just chime in here? This is Dr. Volgman. What I usually tell my patients is my nutritionists actually recommend plant steriles. So something like Promise or Smart Balance, they are plant steriles that are not cholesterol or hydrogenated oils or fats, and that's what my nutritionists recommend. It can actually lower your cholesterol because it competes with the binding of the animal cholesterol.
And I'll just add one more thing, but you can't. They're not very good for cooking. They're good for, like Dr. Volgman said.
That's true.
Like to
sorry about that.
Or like that, but not for cooking. I don't recommend it for cooking.
Yeah.
It's water. They turn into water basically.
Okay, well, thank you both for your expertise. Our next question here is actually for Dr. Volgman, and it is, what is the biggest misconception that your patients have about heart disease, and how do you address it?
The biggest misconception still is that it's a man's disease or an old person's disease, but anybody else but them. So we all have to personalize this risk, because even young women can have arrhythmias or heart disease that can affect them. You hear about these young women who've had heart attacks, or they had pregnancy-induced cardiomyopathy. So unfortunately, it's often thought of as somebody else's disease. But we all can be at risk for heart disease, unfortunately.
Thank you. The next question is for Chef Lala from Carrie Lovelace, who is our chair. Are organic fruits and vegetables really worth the price?
They are. It depends on what they are. If you're actually eating the peel, that's when you want to do it for like an apple and things like that. But for an avocado and stuff, it doesn't really make that much of a difference. And you know, nowadays you should really look into it. A lot of people think, oh, there's a misconception, because at one point they were extremely expensive, but now there's a lot of places that offer competitive prices in different supermarkets. So really take a peek, because sometimes it's definitely worth the extra money, and sometimes it's not. And so once again, if you eat the peel, then go organic. But look for resources. Farmers markets are great. I know that Walmart has a great program now, but you know, look around.
Thank you. Another question, which is actually for both Dr. Volgman and Chef Lala. Why do more doctors not integrate natural and homeopathic medicines and lifestyle changes into traditional medical practices and chemical drug therapies for treating heart disease? So whoever wants to start answering that one.
I can start.
Okay.
So we are taught to definitely emphasize lifestyle changes. It's just that in a 20-minute visit with a physician, if you have a lot of problems, if you have a lot of questions, then the doctor can sometimes run out of time to get to that. But we definitely all emphasize lifestyle changes. What we don't emphasize or recommend are things that we don't really know much about and there's not a lot of data on. As evidence-based physicians, we are taught to only recommend things that we have studied and that we have proven to be statistically significant and beneficial to our patients. So it doesn't mean that those are not good for certain people. It's just that we can't recommend it as a physician.
And from my experience, what I have found is that it's not that doctors don't want to, like Dr. Volgman said, is that, there really is no cookie cutter for two people. For example, there's no two different, exactly the same case of diabetes. So when you're trying to manage something and you're trying to find a homeopathic, cure or even a lifestyle change, someone running 10 miles ahead of time and then eating carrot soup, their sugar might not be affected. Somebody, and the next person it might. So like, for example, my father manages his diabetes with exercise. My mom manages it with food, and they live in the same household. But that's what works for them. So it's really hard. And the study of nutrition is rather new. A lot of people don't realize that, but it really is. It's something that's very new. And correct me if I'm wrong, Dr. Goldman, but there's a very short time span in which doctors do study the actual nutrition. So I think those are the reasons why.
Yeah, and just to chime in, it's a lot easier for doctors to give them medications, get great results, and be done with it. But if you're somebody who doesn't want to take medications and you really think you can do it with lifestyle, we welcome that. I mean, I definitely emphasize that in my office. We give free nutritional counseling. We have an RD and their students who give free nutritional counseling to our patients. Whoever wants to do that, we definitely will work with them to change their lifestyle.
Great, thank you. The next question is for Dr. Volgman. How do you know if you have heart disease before having a heart attack? I have high cholesterol and high blood pressure, but what tests will tell me if I have heart disease?
Most of the time, if you're not having symptoms, there's really no need to do a stress test or a lot of fancy tests. All you need to know are your blood pressure numbers and your cholesterol numbers, your weight, and your BMI. And if you can control those, you're really doing as much as you can to lower your risk. If you start having symptoms, that's when you go to the doctor to get evaluated with stress tests and other cardiac tests.
Okay, great, thank you. Okay, Dr. Volgman, do you ever prescribe sterile supplements? And then a second part of the question, which is actually more for Chef Lala, what foods contain sterols? So let's start with, do you ever prescribe sterile supplements?
Yes, what I do is actually I refer those patients to my nutritionist, and they are the ones who monitor, because that's in the realm of the nutritionist to give. They're over-the-counter medications. It's called Cholestoff, and it's a form of plant sterol. If a patient doesn't use a lot of spread, like a butter substitute on their foods, then they just don't get enough to lower the cholesterol. So we sometimes will prescribe that.
And so what's happening now is a lot of companies are fortifying food with sterols, kind of like when they used to fortify the milk with vitamin D the salt with iodine. So there's different cereals, whole grains that are rich in plant sterols are like rice bran and wheat germ and brown rice and whole wheat. And there's also legumes, which are lentils and dried beans and peas. And then the ones that are, peanuts are actually one of the best sources of natural sterols. And then there's sesame seeds and pumpkin seeds and pecans and almonds and walnuts. So there's great ways to naturally consume sterols in a delicious way.
Great. Thank you, Chef Lala. The next question is for you, actually, Chef Lala. What are some of the steps to help prevent diabetes?
Oh, some of the steps are definitely keeping your weight down. The second one is to be active. Another one is to find out about your family history, and whether or not you have it. Like me, I'm predisposed to diabetes because my entire family had it. And then you want to also, if you're pregnant, you want to find out whether or not you have, gestational diabetes. You also want to check, there's also other different signs that you have. You have leg cramps while you're walking. You have poor vision. Your kidneys. All these are signs of more advanced diabetes. But definitely always visit your primary care physician and your endocrinologist to find out. Don't ever read something on the internet and then self-diagnose. That's the biggest mistake you can make with diabetes. You really, really, really need to find out, because in a matter of seconds, people think that having high blood pressure, sugar is bad. Having it low is even worse. So never try to self-diagnose. And then, if you're older, that's a thing. And also, once again, like Dr. said, being Hispanic, African American, and people who have low birth weights also, and then a diet that's high in sugar and cholesterol, processed foods, and then someone who just doesn't exercise at all. Those are all different things.
Thank you. And Dr. Volgman, did you want to add anything to that?
No, she was brilliant.
It was a good answer.
It's like, hey, she can be a doctor.
We're going to close
excellent,
here.
Excellent point.
Great. Thank you, both of you. I'm going to close. This is Lisa again. I want to close here and ask one last question. The same question to each of you, which is, if you could tell a woman to take one action to begin a more heart-healthy lifestyle, or just to start taking a step down the road to creating a more heart-healthy lifestyle for herself, what would that one action be? And I'll start with Dr. Volgman.
Okay, that's a hard task. I would
You could
say,
do three. You could do three. That would be okay.
Oh, okay. I would say write down a goal for yourself if you're having problems with your weight, having problems with your blood pressure. Write down a goal of and a date when you can have that done. It's like with cigarette cessation. It really helps to have a date when you're going to stop. So you write down a date when you're going to get to your goal. If it's just to decrease your weight by 5 pounds or decrease your weight by 10 pounds, write down a date and try to achieve that goal by that date.
Great. Chef Lala?
You are what you eat. I told my sister that, and she says, just call me cheap and easy. So you are what you eat. Just make sure that if that's what you're putting in your body, that's what you're going to be. Think quality, not quantity. Just eat really good, nutrient-rich foods. And the second one, and the last one is to all those women out there. I get it. I mean, we're busy. It's hard to take care of yourself. You put everybody else before yourself. But you know what? You're not going to be good to anybody else if you had a heart attack, if you're in the hospital.
Or stroke.
If you love somebody that much where you're willing to give everything up for them, make sure that you're not willing to give up your life, because then you're not any good to them. So keep that in mind. Take care of yourselves. That's what your kids want. That's what your family wants. They want you to be around. They want you to be healthy. So you want to do something good for everybody. Do something good for yourself today.
Well, it sounds like Chef Lala has taken a cue right off the Women Heart cue card, where we always say that if you want to be around to take care of those you love, you have to take care of yourself first. And too often, all of us, many people, but particularly women, don't do that. And that is one of the key things that message that we try to spread to help people, help women take charge of their heart health and to take care of themselves. And I think that the information presented tonight is one of those steps that we take. In fact, I have an email right here that says, "This has been wonderful and so informative. Thank you all so very much." So I could not say that better myself, and that was from one of our participants. Again, thank you so much to Dr. Volgman, Dr. Annabelle Volgman. Thank you to Chef Lala. Thank you again to Burlington Coat Factory for sponsoring this webinar tonight. And we hope that everyone will go to our website. You can also contact us through that website if you have additional information. If you are a patient and you want to be connected with one of our support groups locally or our online support group, everything's there at www.womenheart.org. So again, thank you all so much for participating, and take care of yourselves. Good night.
Thank you.
Thank you.
Bye-bye.